Welcome back.
I can't believe we made it.
Pilot episode is history, and here's episode 1, real guests.
Real guests. We're going to have a lot of fun today.
We have Lesley Pyjas coming to us from Whole Health,
I heard.
and then we have Joan Chipps,
Yep, Joan.
Workplace Violence Prevention Program. So it
Yep.
should be a good show.
Yeah.
So let's go over some of the business that we have to take care of first.
Some upcoming events.
So for Juneteenth, it's a day of service.
I signed up.
You did.
I did. I'm going to be volunteering my time.
Good, then you can cover the event.
Yeah.
I'll be camping, unfortunately. I planned it before the event, before it happened. So.
Put your hands up. They're not really working hands, are they?
No, they're not.
It's okay. Go ahead.
So they are going to be doing a food drive and a
Yes.
beautification of Bailey. So
Yep.
we're trying to be good neighbors and help to beautify Bailey Avenue. So if you're
Yes.
interested, you can reach out. We're gonna flash a flyer right now, and you can get the information right there if you're interested in helping out and volunteering.
It's always good.
Yes. Also, did you do the VA2K walk?
If I say no, don't think less of me. However, I did go out to the food truck. There was a food truck.
I know, Polish food.
But there,
Polish
and
fella.
I did have a pierogi, which was delicious. But you were walking in it.
I did walk, and I walked
So
with
proud of you.
Jermaine and Cheryl from Laundry. Lovely ladies.
Really?
Jermaine
Oh.
has been here for 40 years. Cheryl's been here for 15. It was a nice walk. We talked. I bet the stories Jermaine could tell. So here's a shout out to Jermaine and Cheryl. I had a great time walking with you at the VA2K walk.
That's wonderful.
So
That's great.
Let's bring on our first guest.
Lesley Pyjas.
Okay, so we're joined by Lesley Pyjas.
Is that how you
That
say
is correct. Pyjas.
Pyjas. I was saying it wrong, so I apologize.
it? Me
That's
too.
okay.
But welcome, you're our first official guest.
I feel so important.
You should.
You should. You
This is a
should.
great thing we have going here.
It
It's
is.
super fun
Quite a
and
hit.
knowledgeable. Can get that word out, whatever you have going on. So why don't you
Well, this
start
is
us
a great
off?
way to start.
Yes. So why don't you start off by telling us how you ended up at the VA?
So I am a vet.
What?
Yeah.
Oh, let me read it. I'm psychic. Air Force.
Yeah, good guess. But I actually count 3 because my first husband was a Marine and then I went in the Army Reserves.
Okay.
But I didn't look really good in green and they wanted me to stay in a tent, so I didn't stay real long.
Oh boy.
You know, Air Force, we do hotels.
Yeah.
So anyway, I did a clinical here when I was in nursing school, and I would not have worked at that VA. It was a long time ago, but we have made so many great leaps and bounds in progress here that I am so happy to be here and working
That's
at
wonderful.
this VA. Yeah, I'm excited.
Was that your job in the military?
No, I was not a nurse. I was an Arabic linguist.
Wow.
Yeah,
wow.
Well, there you
yeah. I
go.
know the words for
Interesting.
tank and machine gun, and then some cuss words.
Okay. Well, why don't you tell us a little bit about exactly what Whole Health is?
So Whole Health is this culture change that the VA is trying to institute across the whole network. So instead of your doctor saying what's the matter with you, they ask you what matters to you.
Okay.
And that way it's patient-centered. So we get to focus on the veteran. And there's a big push for employee whole health as well because we just went through COVID and that really wreaked havoc on all of us. But I got to tell you, I spoke with Dr. Ceylani the other day, and she was amazing. She said that asking that question, what matters to you, has made such a difference in her practice. She feels like there's a closer, more healing relationship with her patients. So I really appreciate
wonderful.
that. Yeah.
That's crazy, isn't it? Just
And then we also
simple
incorporate
changes.
some, simple things. So we incorporate some complementary and integrative health. And we do some health and well-being courses as well. So everybody knows we have a massage clinic. We also do virtual yoga and virtual Tai Chi. We're going to be opening a Reiki clinic soon. That'll be available for both.
I was your guinea pig when I
I
first
know.
started.
So
I loved it.
it'll
It was
be
awesome.
both for staff and veterans. So
Oh, nice.
just waiting for Dr. Jowdy to sign my SOP, and then we'll be
Nice.
ready to
Oh,
roll
that's
with that.
Great. That's
yeah.
great. So what is the map?
So MAP is mission, aspiration, and purpose. And there's actually a clinical reminder to remind the providers that they should ask that question. And you may have to reword it to your own words. But it's that question of what matters to you. It could be, what really inspires you, what's most important to you. So we can ask the veterans and then focus on their care. Let them
great.
drive the bus.
That's a good idea.
Awesome.
Yeah.
How is whole health accessible to the veterans and the employees?
Okay, so you can talk to your primary care about the things like Tai Chi, yoga, massage. And then you can also call us, and I can give you our number is 716-862-7885, and get into any of our health and well-being classes. We have Intro to Whole Health. We also are doing some live classes now at Western New York Heroes.
Wow.
We have a memorandum of agreement with both Western New York Heroes and Veterans One Stop, and we are doing live classes there.
Oh, that's neat.
So it's
That's
really
good.
nice. We actually started a journaling group over at Western New York Heroes. Yeah.
Oh,
That's
I
different.
journal. That's
Yeah.
good.
So do you think it's making a change in the culture in Western New York?
I absolutely think that we're making a culture change. It's starting to really explode. People are grasping the concept. It's patient-centered care, something nursing's been doing for a long time.
Right.
So now we're getting it where we're not focusing on the disease.
Right.
Yeah. So how can employees get involved with whole health?
Excuse me, I'm sorry, I got a tickle.
That's okay.
So employees can reach out to Mimi Haskins, is our employee whole health coordinator. And I'm going to ask you guys to interview her maybe on one of your podcasts in
I
the
think
future.
she did a presentation for primary care on
did.
Tuesday, and she is full of energy.
She is full of energy.
She was
and
all
she's gonna
over
be
the
yes,
stage.
she's gonna be doing
Yeah.
a dance party. So employees get an in-service from her during new employee orientation actually.
That's great.
And she's gonna be starting a dance party and starting some other things that are available. It's literally there are some around the nation where there'll be 1,000 people on teams just for 15 minutes, just dancing up a storm.
I
It's
can
a
hear them in
riot.
my office when
Yeah.
they're having fun down the hall.
Yeah.
And caregiver support.
Yes.
They're
yes.
really involved in it. So
Yeah.
it's great.
So there's a lot of other stuff, and the Reiki I talked about coming,
Yeah.
and then our massage therapists, both here and at Batavia, and we're going to have another one coming here. If they have a cancellation, a lot of times they'll pop over to a unit and offer some demos to the staff.
That's awesome.
Well, if you ever start acupuncture, let me know. I'll be the guinea pig for that.
Okay, well, we do acupuncture here,
You
but
do?
it's only for
Oh,
pain, so we need to
oh.
expand that. I'm working on that.
Ooh, that's a wonderful treatment.
Yeah.
I love that. So,
Yeah.
I can't believe you had time to come and visit us in your busy
Oh, I'm
day.
so excited to be here. I was
Yeah.
really, really looking forward to
Okay,
this.
and you're not off the hook yet.
It's
time for 4 questions. Okay, Lesley, just pick 4 random sheets.
One at a time.
The only rule is you've got to answer it.
Okay. Oh, these are.
I'll take the other 2.
Yes,
Okay.
definitely.
All right.
Okay.
You go first.
Question: frog or toad?
Frog.
Yes, they're
Yeah.
so soft.
Walk or run?
Walk.
NASCAR or water ballet?
Water ballet.
Superman or Batman?
Toss up. Could go either way.
All right,
That's a
fair
good
enough.
one.
Leslie,
Thank you.
thank you again for
Thank
being
you.
with us.
Yes,
and
thanks for showing
we
up
really
and-
appreciate it.
Oh, thank you.
I look forward to many whole health events.
Awesome.
All right.
We'll see you guys soon.
Thank you.
Bye-bye. And now we have
Does-
Joan Chipps joining us. She is the Workplace Violence Prevention Program Coordinator. So we're really
Welcoming
excited to have
Joan Chipps today. She is the Workplace Violence Prevention Specialist, or something like that. What is your title, really?
Workplace Violence Prevention Program Coordinator. It's a mouthful.
Wow, that is a mouthful, but it's a big important job. So
Yes, it is.
we thank you for doing this, and glad you could join us today on Cuppa Joe and Tea with Melissa.
Yeah.
I'm glad to be here as well.
So tell us about how long have you been in the VA, and what are you other jobs that you've done here, I guess.
I have been, oh my goodness, this will be my 28th year
Wow.
in the VA.
28. years.
Yes. I started at the VA, actually at the Manhattan VA.
When you're at 12.
When I was 12,
Okay.
yes. I was gifted.
Yes.
And so I worked there for 10 years before moving back to Buffalo, and then started at the VA here in late 2005.
Okay.
I've been part of behavioral health for almost my entire career, working on inpatient psych, working as the suicide prevention coordinator, outpatient mental health clinic, and now this position, the workplace violence prevention program coordinator, is not in behavioral health. It is a facility program, so it encompasses larger, it's a larger in scope than a behavioral health program.
What an
So can you tell us about your role?
Sure. The program is intended to assess, manage, and mitigate behaviors which compromise the safety of our environment and this, our ability to provide health care to our patients, to deal with staff, and to deal with visitors. So my job is to assure that we have policies, procedures, staff in place who can support all of those efforts, because it's a big effort. And the program oversees all of Western New York, so it includes Buffalo, Batavia, all of the CBOCs, the outpatient programs. Our outreach is big, so it's good.
So I bet you're on the road a lot.
I actually am just starting to get out on the road more, which is great. I love getting out to meet people. Since, the pandemic is over, I can talk with people face to face, which is wonderful. So yes, I am getting out,
Good.
doing the road show more, yeah.
So what are some important things that employees can do to help in workplace prevention, violence prevention?
Great question.
Oh.
So it's important to remember that, like some of the other things that we do, workplace violence prevention is everyone's responsibility.
I agree.
The first thing that I would tell all employees to do is to make sure you're up to date on your PMDB training. That is prevention and management of disruptive behaviors. We are all mandated to take it at some level. And I think for me, one of the most important skills that we can, focus on and utilize is our verbal de-escalation skills.
I agree.
Yeah, we have a lot of disruptive incidents that occur, for whatever reason. But I do know that utilizing good verbal de-escalation skills can help to prevent a lot of incidents from becoming incidents where we have to have police involved, or where veterans become so upset that they leave, because we don't want that.
Right.
We are here to serve veterans, and we always need to remember that, and do our best to, utilize civility in all of our interactions with our colleagues, with our patients, with our visitors. Remembering, keeping that in mind, we do the best we can. Mm-hmm. And when we can't, when all of our efforts have failed, because sometimes that does happen, remembering to report. The only way we can address things and understand what's happening in different areas is when we get reports, and we should be utilizing the disruptive behavior reporting system, the DBRS, which is a, facility-wide, it's actually a nationwide database that is utilized to collect information on every incident that occurs at every VA across the country. Gives us a ton of information that can be really helpful in our prevention efforts.
So I'm in primary care, and one of our process improvements are to focus on de-escalation before calling alert, and then de-escalation with the alert, and then debriefing at the end of an incident, so that we can grow and learn. And so we're going to have to reach out to you.
You are definitely going to have to reach out to me.
We're going to have to
No, it's great. Yeah.
collaborate and
Yes.
help our process along. That would be great.
Yep.
So,
Why we're
so
here.
how do employees contact?
Employees, I am pretty much always on Teams, except when I'm doing,
Great
public
podcast.
appearances. I can be emailed, always, available, to read emails, or people can call me at extension 23123. Yeah, those are the best ways to get a hold of me. And I when I'm here and when I'm in front of my computer, which is most of the time, I will always respond. People should never be afraid to contact me, to ask questions. No question is, insignificant or stupid, as a lot of people say.
Yeah, the only stupid
And-
question is one that isn't asked.
There you go.
Right.
And no report is too insignificant to be reported. It's our job to look at every report and decide, what we do with that information. Don't overthink it, just report.
I do think that a lot of people will report a veteran's behavior, but not necessarily a coworker's behavior. Do
Oh,
you
that's a
find
good
that?
point. I do find that. That's a good point, Melissa. I think a lot of people are not aware that the DBRS system is also for reporting, employee-on-employee incidents. There's far fewer of them than there are patient incidents, but we do have incidents of harassment, bullying, threatening behaviors, unfortunately, from staff to staff. That's just not good. It's not
Right.
cool, and it's not acceptable. So report it, and we will take, the proper actions to make sure we're addressing that.
Well, Joan, I cannot say thank you enough for coming. This has been a great learning for me.
Me too.
As me as well. But you're not off the hook yet,
Oh, dear. Okay.
because it's time for four questions.
I can't believe he caught that.
So
You did.
Joan, there's only one rule. You have to answer all the questions that you pull. So you got to pull 4 questions, give her 2, give me 2.
Okay. Oh, this is.
I promise
okay.
it won't hurt. It won't hurt, Joan.
Oh, maybe this one. No, I'm just
Did I already
kidding.
give you 2? Okay.
Yes,
Okay.
I'm good.
This is exciting.
All right.
You want to go
Whoa.
first, Melissa?
It is.
Sure. French fries or potato chips?
Oh, man. Potato chips.
There you go.
That has been one of my biggest weaknesses for
Is
my
that
whole
right?
life. Yes.
Oh,
Okay, so resort or cruise ship?
Resort.
Resort?
Yeah.
are you afraid of
Okay.
ships?
No,
Okay.
we're not cruise people.
Yeah.
I want to be in there. I want to,
That's
be in the
right.
community,
There you
be able
go.
to see things. So,
Experience the culture.
yes.
That's right. All right. Water park or theme park?
I like theme parks that have a water park in them.
Oh,
Got around that one.
okay. Now
Look at her.
here's
She's
the
fancy.
real tough question. Hotel
Mm-hmm.
or camping?
Hotel.
I
I do love camping, but a nice hotel, can't beat
forget
it.
about it.
Can't beat it.
Awesome. Thank you so much for being with us.
Thank
Very
you,
welcome.
Joan.
Thank
Great
you for
second
having me.
guest. We appreciate it.
Yes, second guess. We're
Good.
counting up instead of down.
Oh, that's good.
Yeah, that's good.
That's good. Yeah. Thank you.
Thank you. Bye.
Bye-bye.
So that was a great show.
That really was.
Lesley and Joan,
Phenomenal guess.
yes, for our first real show.
Yeah, our first real show.
That was great.
Did you maybe forget to mention something?
I did forget to mention something.
Yes.
So Pride Month is coming up,
June is my favorite month.
and if anyone is interested in walking in the Pride Parade,
Yep.
we'll flash the flyer up there, and you can contact him, and they'll be happy to have anyone walk with them in the Pride Parade.
I'm walking in the Pride Parade. Are you?
I am going to walk in the Pride Parade this
Yeah.
time. Yeah.
I'm
Because
gonna-
you're walking.
I did last year. I walked with my last company that I worked for, and it was over the top fun. And I have never been emotionally moved during a parade as I was then.
Awesome.
Just really neat people out. Everybody's just one. We had men and women lined up at the bathroom, in both men and women. Not even lying.
Fun.
It was fun. I was like, look, we don't have to do this. We can be in any bathroom.
Great.
Yeah. So that's all I have.
So thank you for tuning in and watching our show. I hope you're enjoying it. We are enjoying all the feedback we're getting.
We are.
And if you have an idea for a guest or a show,
Please call Joe, because I'm so busy.
and I'm not at all. No, really. Email us or whatever. We appreciate it. Bye, everybody.
Bye.